Well, this morning we want to continue to help parents get a better understanding of attention deficit hyperactivity disorder, or ADHD. Earlier in the week, we talked with pediatrician Dr. Michael Wasserman about the symptoms, age range of diagnosis, and that the causes of ADHD are really unclear. So today we want to continue that conversation. Dr. Wasserman, let's pick things up with how you go about diagnosing ADHD.
Well, most commonly what happens is the child comes to me when there's something going badly in school. The parent will bring the child in and say, there's just a concern and things aren't going well, and that's what the classroom teacher's telling me. So to diagnose it, first you have to look at, is there a medical condition that can explain this? Problems with vision or hearing, some sort of neurological problem like seizures, some other psychological problem like anxiety or depression or whatnot. And assuming you can at least in part put those aside, then there's a couple of ways to approach this. The simplest way is to do some rating scales, like the Vanderbilt forms, which we oftentimes use. And in these forms, the parent, the teacher, and sometimes the child, depending on the age of the child, will fill out some questionnaires, which give us some idea of whether the child's having problems being able to stay on task, being inattentive, being hyperactive, impulsive, and so forth. And that's sort of a starting point. And then the advantage of that is it's inexpensive and it's quick in terms of time elapsed from the beginning of the process to the end. Another approach, of course, is to get a more in-depth analysis done by a child psychologist, or even better yet, by a developmental team, which several places have in town. That process is much more involved, it's much more expensive, but it gives you much better information.
And
so once you've...
No, go ahead.
I'm sorry.
Go ahead.
So once you've established the diagnosis, then there are different steps in the treatment plan. And one step that parents don't always want to do because it's a lot of work is to begin with some sort of psychological therapy or counseling, because the child in the long term needs to learn coping skills to deal with whatever his or her issues are with how they learn, how they stay on task, and how they stay focused.
Sure.
Organizational skills are important. Social skills are important. Self-esteem is important. And this is a long-term investment in time and energy to get the child where we want to go.
And then you talk about parenting skills before you even get to medications, and that's probably tough to talk about with a parent.
Well, you want to make sure that the house is calm, organized, and supportive. I want to get the kids off of screens. I want to get them outside and moving. I want the parents to be consistent in how they're interacting with the child, giving rewards for good behaviors, consequences for behaviors that we don't want to encourage. Sometimes there needs to be some sort of family therapy in terms of how the child and the parent or parents interact. And then the school, of course, key, especially the classroom teacher. And there are once the diagnosis is officially established, there's what's called 504 accommodations, not the area code of New Orleans, but this is a part of the federal law. And the child can get extra services, longer time for testing, and other appropriate additional services from the school. So you have to request it, and then once you do that, and I recommend you do it in writing as the parent,
sure,
then a clock begins, and the school has to adjust in the appropriate length of time.
And could there be coexisting conditions?
Well, oftentimes there are. So it's usually ADHD and learning disability, oppositional problems, conduct, anxiety, depression, bipolar. So it's really not a clean area to deal with in the sense like if you have strep throat, you take penicillin and you're going to get well quickly. This is much more complex. It's an ongoing relationship that you need to have with your pediatrician, child psychologist, or other therapist. And then you need to help this child over the months and years deal with the problem, get to a good place, and grow.
I feel like this is very vivid in my memory as a kid. Any classmates that were hyper, their parents automatically, my kid has ADHD, we need medicine right now. They didn't want to go through all those other steps. Are you still seeing that often?
Yes, and frankly, as a pediatrician, we're supposed to make sure that we're not over-medicating children. And so really there's this sequence that I just outlined of how we like to go through it. Mm-hmm. And then the next step is to talk about medication. And some parents come in and say, I never want my child on medication. And some parents say the exact opposite. Sure. The ones who say, I never want my child on medication, we'll start with the things that we've just outlined. And depending on how the child does over the next month month, 2 or 4 months, the parent will come back and say, things are going very well, or maybe not so much, and we need to consider medication. And one of the nice things about medication is you can figure out pretty quickly whether it's going to be appropriate and beneficial to the child. So this will be helpful in terms of the stimulant medications, which is what are oftentimes talked about, the Ritalin type medications, and they're really much better cousins in these different families of stimulant medication now than there were 10 or 20 years ago. They tend to be longer acting, so you don't have sort of these ups and downs as much. You can, depending on the different medication, different children respond quickly, so we can oftentimes work around the side effects of the medications. And one of the nice things about the medications is really when you remove it, the effect goes away, and typically the side effects go away. So you're going to see pretty quickly it works well, my child can tolerate it or not, and then deal and go forward from there.
All right, Dr. Wasserman, a very complex issue. Thank you so very much for explaining it for us.
My pleasure.